Carol. I'm 54. I'm here to tell you today about fillers and what they do for me as enhancing my life.
Whether or not we want to admit it, looks matter a lot. Why do women want this service?
Early signs of aging reveal a deepening of facial folds, an increase in muscle-induced wrinkling, and loss of facial volume. Soft tissue fillers provide aesthetic physicians with an effective means to treat patients with non-surgical facial rejuvenation.
I started getting these folds in my face that I thought the only solution was to have a facelift, and I thought that was such a drastic step to do. I wasn't sure how to go about handling the aging process that I was seeing in my face. I have a girlfriend who's from Newport Beach who's actually 10 years older than me, and all of a sudden she was looking my age, and I said, "What are you doing?" And she told me that she was using fillers. And I thought, this was a way for me to handle the aging process without having to do major surgery.
The reason why I chose to do it is because, I'm plain, but I'm vain. I don't do much to, my face on a daily basis. I don't, fortunately, don't have to rely on my face for a living. But it's nice knowing that even with very minimal makeup, I don't have to worry about how my face looks.
I was getting the look of where I look tired. And it happens when you get to be in our middle 50s, late 50s. And it was something that I felt could take that edge off.
Fillers are substances that augment soft tissues. It is injected into the skin, giving it smooth appearance. Since the filler is eventually absorbed by the body, the desired effect can last for 6 months or more. Varying results depends on the health of the skin, the filler used, and the skill of the doctor.
My husband, who's not a real advocate of the facelift look or the filler look, was not really gung-ho about the aspect of me going for fillers. But after I did it, he was so pleased with the process and happy with the end result that he was all on board, and that made me feel really good.
Being able to look good to yourself, feeling good, naturally helps you exude a greater sense of confidence. And I think it makes a great first impression.
Dermal fillers, also known as soft tissue fillers, do what their name suggests and improve the appearance of the aging skin in the following ways: wrinkles, fine lines and deep creases, scars and other imperfections, wrinkled lips, plumping up cheeks, contouring the jawline and other areas of the face, restoration of facial symmetry. The useful face has a soft, full appearance as opposed to the flat, pulled look when people age.
I started using Botox about 5 years ago, and it was a great decision. So I decided that my next step would be to do the fillers, but I didn't know exactly where to go.
I mean, Dr. Krakovsky has honestly some of the best bedside manner I have ever witnessed in a physician. Not to mention, the technical skill combined with an innate sense of artistry and aesthetics. Dr. Krakovsky really knows what he's doing, and that's why I keep coming back.
So I went to Dr. Krakovsky and we discussed what my expectations were and his recommendations, and the end result was a perfect match for me. I walked out of the office without feeling that I was overdone, but I walked out with a look that I felt made me look refreshed, and that's what we're all looking for as we age. Not to look 30, but to look like we're vibrant, healthy individuals.
The use of fillers has an excellent safety profile and is considered to be ideal in many respects, but ultimately do require periodic maintenance to maintain the desired effects.
Doing something good for yourself is important. When you look and feel your best, you present yourself to the world with so much more confidence. For my business life, this is an asset. For my private life, it is wonderful. My husband thinks I look terrific, and I feel beautiful.